Hi everyone, please. We call all the panelists to take their places and the session starts. So please take your places, everyone.
Hello. We have now less than 1 hour together. But I think and I hope that this 1 hour make changes for the good. The question is, we are confronting now everywhere in the world, the rich and the poor, problem of affordability of treatment. Other thing, affordability of better value cancer treatment with dignity, social, financial, physical dignity. And I mean physical dignity is not humiliating patient but an unnecessary thing. It is not a talk of politicians. And again, because there is confusion, it's not a talk of public health. It's not a talk of global health. It is global, a part of global health. It is concerned with how to work for this. We are doctors, scientists, physicists, chemists, so we are not politicians. So how science can give us solutions, unlimited solutions, unlimited scientific approaches. Publications will not do all. Publications just can lead the movement, can lead the current, can lead the information, can call for to develop this. There is duties for all organizations, for all society, but for us, there is duties. We are take this duty in Harvard Global Health Catalyst Win-Win Initiative to be part of our work. Its first wing is explorations, encouragement of explorations of scientific approach to increase affordability of better value cancer treatments. We don't speak about begging, about pity, about weeping, about the magnitude of the problem. We know all this, about the tragic situations. But we're thinking about science. Pharmacokinetic studies, maybe to find, there are many, to reduce the total cost of treatment, not even the price of a drug per se. More indications, pharmacokinetic study, pharmacodynamic study, pharmacogenomic studies to select which patient will get benefit of this drug and which patient will not benefit. Radiobiology, radiotherapy, clinical trials, investigation for surgery, investigation for radiology, everything. Scientific approaches. I know that in 1 hour we can achieve all. But if we can arrive at the end with our distinguished panelists and with all of you, and what I sent, I announced in, you will find a copy of it after 1 week in www.isodoc.org, and you just click on win-win. You'll find the question of this session, because it needs you, all of you. When Ross Berbico or Eric Ford presented their talks, this is a scientific approach. This is not primitive medicine as some people think. It is not accepting publication or science below the levels. No. When we say patient-centered, we are not away from science. It is the science. Because the third revolution in health care and in science, and the fourth revolution is patient-centered, and plus the fourth revolution now is AI and big data and the advances in computer. So we are not away from science, we are in the heart of science. This is just short introduction, but we need all of you. This, I hope, to be the start of big movement for the sake of all. For the sake, and I repeat, the sake of all, because it is win-win, as we say, because we are confronting with skyrocketing increase of everything. And as I said yesterday, and I can send you the article, is ASCO survey, 40% of Americans people abandon oncologists, abandon for alternative medicine because of cost. Imagine what is going on in developing countries. And just a few, last month, the FDA announced it for pilot study for recycled pills of immunotherapy. Because patient die, leave some packets, then you can use it again. This is here because we are confronting a crisis. Will not beg for solution, but we who create solutions. Science, by science. First, I would like to hear from Professor David Collingridge. As you know, this is the Lancet of Oncology, and he's the editor-in-chief. And what he said is very important.
No pressure.
Yeah, no pressure, thanks.
Okay, okay. Forget about this, okay.
You know, the issue of global health really and the publishing aspect of global health is extremely important. And I always say to the editorial teams that I look after within the Lancet group, I have two roles at the Lancet, I should say. I'm the editor-in-chief of Lancet Oncology, but I'm also the publishing director for all the 18 journals. And I always say to all of the editors to keep open minds whenever they're reviewing anything, any submissions. It's very easy to look at a paper and you go into this paper with your PhD hat on. You can always find a problem with everything. But actually there are times when you really need to say to yourself, is this the best data? Is this the best information we've got on this problem? If it is, then we should proceed with it, regardless of the faults. And the Lancet pursues that quite vigorously in many avenues, and I mentioned some of those yesterday in my talk, around commissions, for example, which is where we actually challenge a community to find the data. Just last week, I was in Montevideo, and I was talking to one of the government ministers there, and it's really fascinating to see how much data the government is sitting on, and none of it's published. That real-world data is absolutely incredible. If you look at the breast cancer survival rates in Uruguay, they're approaching 85%. This is the same as us in Western Europe, in Northern America. But would you have thought that from Latin America? From Uruguay, clearly that is the case. None of that data is published. So, you know, I think it's the job of an editor sometimes to encourage publication of this data. It's very easy in a journal like mine, and Tony as well here from the Red Journal. We see these big, grand clinical trials, phase 2, phase 3 trials, but we know they're a restricted number of patients in very select populations. So that real-world validation that these treatments work is incredibly important. But also it goes beyond that. It's about providing the evidence to inform policy and health policy. We all bang on about evidence-based medicine, but we really should be shouting about evidence-based policy and dissecting policy from politics, which is incredibly hard, but we need to be able to do that. And I think journals and magazines have a great role in informing and educating everyone in this area, but also finding that data and bringing that data to light.
Professor Anthony Zitman, introduce yourself, and in less than 5 minutes we need something like your view on this.
I'm Anthony Zeitman. I'm the editor of the Red Journal, which is the radiation oncologist of the international journal. And I mentioned this last night, but the thing that always staggers me about medical journals is that in this world of Instagram and Google, they still exist. And they actually bind us together. They create their own communities. A radiation oncologist in Peru and Boston and Bogota and Botswana, they will all read the Red Journal. So that's an incredible opportunity. It's an opportunity to publish good and relevant science. And then if I feel that a particular piece of clinical science has relevance sort of outside the usual confines of Northern Europe or the United States, I'll actually solicit a commentary, an editorial, to highlight that fact. But the one thing that we've found that's been very sort of community binding is every second edition we invite someone from a particular nation around the globe to write their experience of the practice of oncology in their own country. And I don't want to know what's similar. I don't want to know what's similar between Uruguay and the United States. I want to know what's different. I want them to bring out cultural differences, and I want them to bring out their local solutions. And we've had some marvelous examples of this. I mean, just hearing from Japan. What is another high-tech nation? But that's a nation that has a very terrible relationship with radiation. Think Hiroshima, think Fukushima. So they have big problems essentially persuading patients to have a life-saving therapy. That's their problem. In Iran, one of the problems is sanctions. It's impossible to get radioactive materials for the treatment of cervical cancer. I know about impossible, difficult. And then, in the Philippines, it's a nation of 7,000 islands. And all the radiotherapy is concentrated really on one of them. And that's in a city, Manila, with the worst traffic problem in the world. So, that's the problem they have to solve. There are other nations which have learned to, there's one very good example, is also from the Philippines, of great resourcefulness, in which the immobilization devices that hold patients still for radiotherapy are very expensive. And they went to their local mattress manufacturers, and they got something that they call chemical A and chemical B, which when you mix the two together, very cryptic names, but you mix the two together, they make a fabulous material for holding head still within a radiation beam. Now, these are little examples of local solutions that can be sort of propagated through our journals. So the journals are places for good science, and you have to highlight that, but they're also opportunities for us to sort of showcase the innovations, we'll call them. Not necessarily scientific, but innovations that people have developed for their own environments.
Thank you very much. Dr. Gemma Alderton.
Thank you. Is that on? Yeah, sorry.
Introduce yourself, please.
Yeah.
Sir.
So I'm Gemma Alderton. I'm senior editor at Science magazine. I commission and edit commentary and reviews at the journal. I don't handle research manuscripts. So Science is a kind of broad, multidisciplinary journal. We're not necessarily a clinical journal, but we are very much interested in clinical problems and global health. And our global health coverage has predominantly been infectious disease. And so I'm here to learn more about the issues that are being discussed at this meeting, to meet people so that I can tell you that we are here, we want to hear from you. Science is not just a research journal. We have lots of parts of the journal for commentary and policy forums as well, to try and help crystallize key ideas in important areas. And I would emphasize that we are very happy to talk to you, and hopefully we can find some ways to raise awareness of the topics that have been discussed at the meeting this weekend.
Thank you very much. Professor Ricardo Audesio.
Riccardo Audesio, I'm editor-in-chief of the European Journal of Surgical Oncology, and I'd like to start by disputing the words that you used to open the session, because to be honest, I'm very critical of science. In fact, science in its own, I don't think it ever exists and will never exist. I take the scientific approach as a work in progress, so that you pretend you define something which is good, just aiming for the next step. Therefore, to me, a rigid, strict framework that based on the foundation of clinical trials is just a fake bubble that only suits pharmaceutical companies, basically, because they don't have outcome data. We do want outcomes data, as David was mentioning before, because we know that since total mesorectal excision was introduced, 10 years later, we have national database. All Norwegian, Scandinavian countries, all Dutch people enjoyed the 15, 20, 18% gain that was supposed to be achieved. That's the whole country saying so. We don't need a trial. And therefore, I'm a bit reluctant in setting rigid guidelines. And within the global perspective, therefore, I think that we need to be respectful of what our scientists have been producing, very much so, encourage them to do more. But I cannot see economically advanced countries imposing or bullying low, medium income countries because their standard, the gospel, is not achieved. Hang on a second. Would it not be interesting to look at the opportunity of critically assessing how much of the standard is really feasible? And I think this is really a great opportunity that you're offering us. Thank you.
Thank you. Okay. The e-cancer.
Hi, I'm Danny Burke. I'm the CEO of eCancer. We're an educational platform for the global oncology community. And we deliver education in multiple formats. So we have educational videos. We have about 7,000 educational videos. We're actually filming some at this conference with the experts discussing the topics here. We also develop e-learning. We're an EACCME accredited e-learning platform. And we deliver, we publish news from all the leading conferences as well. And I guess the relevance for this topic, we also have a journal which we publish. And we're all about breaking down barriers to education on a global level. So one of the barriers to journal publishing, I guess, and being published in a journal can be cost. So we operate a pay what you can afford model. So the authors, well, over 90% of our authors don't pay anything. Other authors have specific grants, so they contribute in that way. Everything that we produce, everything across the whole platform is totally open access, so there's no delay in access to the information, or and anyone across the world can access all the information as soon as it's published. And really, we're looking to what more we can do. We're a team of about 20 based in an office in the UK, but we have teams going to various different meetings across the world on a weekly basis, looking at what we can do to really support the global oncology community, educating healthcare professionals so that patients can receive the best care possible.
Okay, Eduardo Gazab at the end will give a summary for this, but now it is Jessica.
Thank you. I'm Jessica Friccione, and I work for IOP Publishing, based out of Bristol, United Kingdom, but I work remote in New Jersey, so I don't have the British accent. And I'm here, this is my third or fourth Global Health Catalyst Summit, and it's really an honor to always come and see how much it's grown. And a lot of the work we're doing is in collaboration with Will, Dr. Nagua, to try to disseminate this information that comes out of these rooms to a broad and wide audience. So I have authors here, Erno and some others. Really pleasure to work with people in the rooms. I do a little bit of something different. Books is a different medium than journals. It's a different audience. It's a different structure, but a lot of it is the same. Some of the challenges are the same, and that's getting people access to publications and getting the information out to the widest the widest audience that we can. So some of the things we've been doing at IOP are working with governments. So we have collaboration with the Egyptian Knowledge Bank and the Minister of Egypt. So every person in Egypt, no matter what institute they're at, public or private institutes, and all the libraries in Egypt have access to all of IOP journals and all of our ebooks. So things like that are stuff that we're doing as a company to try to work with funders and governments to get access to as many people as possible. So it's really a pleasure to be here. I like what my fellow panelists have said about keeping an open mind and trying to, in our commissioning strategies, and really trying to separate the policy from politics. That's something that's really resonated with me, and the publications binding us all together. We have a table out there, and I wish I could give books to everybody. I had all my books were already gone by 10:30 this morning. People have a lot of interest in them. But we do have other platforms. We have electronic platforms and other mediums, and I'm happy to work with anybody who has any questions to see how we can better disseminate information. So I'm just really happy to be here. Thank you.
Thank you. Also, I have the pleasure to present the feedback of two important distinguished colleagues. First is Professor David Kerr, who is one of the pillars also of Harvard Global Health Catalyst Win-Win Initiative. And as you know, he's professor in Oxford and emeritus editor of Annals of Oncology, ESMO, and founding editor of a Journal of Global Oncology issued by ASCO. So I'll put this in the web also, if cwisodoc.org, click win-win, you'll find everything within 1 week. The summary that here is, I am certain that this excellent panel will devise a strategy to promote publications, dissemination, and wider engagement with concept of better value cancer care. We have also a feedback from Gilberto Lopez, who is editor-in-chief now of the Journal of Global Oncology, issued by ASCO, and he is very supporting, and he is with us hand in hand. So now to Professor Eduardo Gazap. Introduce yourself. You are well known, sure, but and give a summary, a short summary for this before concluding remark. And also, this is a start. This not end now. It is a start. You will do this change. Please, I would like to send for you, all of you, what was the draft of this proposal, and you will make the movement in the world. Not 1 or 2 or 3 or 5 persons. You will make the movement. That will be for the good of all, patients, science, industry, and all. Professor Eduardo Gazap.
Thank you, Ahmed. I always want to be clear, what are you doing here today, and which are our objectives? Usually, the contributions of the journals are mainly devoted for research and dissemination of scientific information. So I think that the point made by Professor Audicio in this dispute is completely really useful in this regard. What is science? And science is the application of realistic, in health, realistic possibilities to as much populations as possible. If we have science for an elite of people, we do not have science. We have really a gap between reality and a few selected beneficiaries of science. So also there is, I think, a need to explain what is today research. Is basic research, is translational research, in cancer I am speaking in general, is clinical research. Yes, of course, we are not denying science, but we need to have a wider interpretation of the collaboration of science for better cancer control. And we need to include political or legislative of policy research. We need to include, I think, and that was clearly expressed by relevant people in the editorial world of cancer, we need to include implementation research, because science in a lab or in a clinic without applicability to the real populations is not really fair with our patients, but not only for the patients, and that I think is one of the mistakes of our work. We need to work with healthy populations. And one of the, I think, problems of our communities today is that our universities in most of the countries, I am not talking about all the countries, are preparing doctors that actually are for the sick people. And our ministers of health actually are ministers of disease. So I think that we need to widen the concept of publications for research and science to publications for better cancer control that includes information, education, the important component of research, but with objectives that are not only for pure research and success with a publication. Research that means benefit of some kind for the populations or the systems or the globe in general. So I think that the reason for this really invitation to important people is to share the way in which publications can, in a proactive way, not only receiving the submissions, can promote better understanding of the way in which we can overcome the situation in which cancer research is dominated by central countries. As an example of this, if you consider, for example, IARC, the International Agency for Research in Cancer in Lyon, I don't know if you know the constitution of the board of IARC. You know the constitution of a board of IARC? IARC is part of the United Nations system. So they have representatives at the board from the different countries of the world. For example, there was no Latin American countries until we did some work with Brazil and Argentina, and now there is one seat in IARC from all the Latin American region, that is Brazil. So can you imagine that the directions of the main agency for epidemiology and research on cancer are expressing the objectives of some countries of the world, very few countries in the world. And the amount of information that we have, including in the guidelines, in the so-called evidence-based medicine, are really provided by patients that comprises, I don't know, 5%, 6%, 8% of the world population. So the reason, because we were discussing with Ahmed, why, in which way we can contribute with really widening the information and the science, but in a proactive way and trying to include information from sources from different parts of the world. In my country, they are huge databases. One includes 7 million people from the retired. Nobody knows the information that is in that database. I asked for some contribution to our National Cancer Institute in an official way. Forget it. It was impossible. So I think that, for example, asking for a better availability of the existing information from important really publications in the world can contribute a lot in order to have information from sources that are really not accessible for all. So in summary, I think that the idea of a movement that expressed Ahmed is not exactly a movement, is try to share a way of understand research and publications from really the international literature that can contribute in some way to the populations that are really exposed to cancer in many regions of the world, but really the distance between the type of information that is available to the real people and the application in the real life actually is astronomical. And many of you that are here, you know that. So I don't know if I don't know if we have time, but perhaps it is possible to ask for another comment.
Yes, please.
Yes,
yes, please.
Because
we have another 5 minutes.
So I would like to really have your input in the sense, how do you see your journal, if the journal is doing this already, perfect, but if not, how do you see that you can contribute in some way to really produce some type of agreement in order to be more proactive in collecting information from sources that are not today the usual sources of data? What do you think?
We have 5 minutes for all.
Okay, leave.
Yes, 5
So
minutes.
you are the boss.
No, this is not my, I would like to have 5 hours.
But do you have another idea, some
David, maybe have some?
more, so we can produce some type of call?
I can only really talk from my own experience in this regard, and I found actually in my travels around the world, really talking to government ministers and various agencies, that actually that, as Eduardo says, there's a huge amount of data that hasn't been surfaced, huge amount of really valuable data, but actually if you don't ask, you'll never get. And whenever I've asked whether this data could be published, when you're coming from I know I live in quite a privileged position to come from the Lancet with the brand of the Lancet, but it allows, I can ask a minister to publish data, and quite often they're very open to that. So I think editors have that galvanizing, catalytic spirit, if you like, to bring data to the fore, and that's something I would certainly encourage all editors to do.
And I would add, we're sort of beyond the age of the randomized trial being the only thing that could ever get published. We're now in, there are so many data sources out there. There are so many innovative people who are able to look into it that certainly even our junior doctors commonly look at publicly available database, NCDB, SEER, and the rest of it, and there must be equivalents around the globe. Any new source of information we'd be incredibly receptive to.
But it's also, we were talking a little bit earlier, it's about the authors. Ultimately we can only publish what the authors provide. So it's about working with organisations such as AORTIC and the UICC and SLACOM and other organisations that represent different parts of the world to encourage people to submit their data or research or findings or whatever it may be, and then we have a chance to publish it, because without the authors there's no chance of publishing it at all.
We have 2 comments, and And please, Eduardo Gazab will make a summary and revise by all, and then it will be not the end, it's just the start. So please put your input. The success, you call it movement, call it current, call it, we are in need, the world is in need of unlimited number, thousands of research, scientific work to find solution. And science, at the end, is searching for the truth. Nothing is holy. Okay.
I'm Dr. Hussain from University of Massachusetts, professor of radiology. I actually edit a journal. I'm a chief editor of editor-in-chief of Journal of Global Radiology that we instituted in 2015. And one of the difficulties that the Western English-speaking journals are is that much of the world or much of the people who do research in the world are not very good at English. And their work ends up in regional newspapers, and the quality of English language writing is not such that the Western journal can accept, or even they sometimes do not attempt to send their work to the English-speaking journals. And even though their research can be real-time and reflecting the reality on the ground, what we have done in our journal is scholar twinning. Scholar twinning means that if there is, let's say, an article from a non-English speaking country like Iraq, and they have written it up and done good research, but the language is not such that can be published in an English-speaking journal. So we twin the non-English speaking researcher with someone in our department or in the US who will take the data, the local indigenous data, and rewrite it up in such a way that is of the standard that can be acceptable to be published in a Western English-speaking journal. And then we have the original researcher as the first author and the local rewriter as the second author, and in that way we are able to get the real data from the ground rather than government data, which is usually cooked up, as we know from the developing world.
It's extremely important, this comment, really, because yes, Eduardo Gazab informed me that we have some more time for comments. This is very important. Yes, okay. And you.
Thank you so much for this session. I always say that we cannot work in oncology without the media. Whatever is happening on the ground has to go to the people. But a lot of attention has been placed on non-communicable diseases, infections, HIV, tuberculosis. But when we look at Africa and the developing world, cancer is catching up. So I think we need to do more than what is happening. We need to engage more. A lot of the scientists in Africa are overwhelmed by work that the media, whether print or electronic, has to come in and, assist people to know how to put their thoughts in writing. If we don't do that and we expect them to write, sometimes the publications will come and you will refuse them. You won't accept them. So somebody sends publication twice, 3 times, it's refused. And then the person reclines. So please let us engage more. There's a lot of work to be done. And whatever you bring up will also help to change policy and direct attention in the right way. Thank you so much.
Dr. Charlotte, please, your comments, send it by emails, and your titles and everything will include it. This work is not finished by this session. The world is in need. Our patients everywhere are in need. So this is a start. Okay, please. Dr. Charlotte.
Who? Because me or him? Okay, I'll go. Let me go first.
Okay,
So.
no problem.
Okay. So the question I have is, you said that there is a lot of data that's publishable. I guess it would probably be helpful if people can give a little more detail on what do you mean by publishable, because there was a workshop in Nigeria last year, and I think Amaka may be here, who she did a survey and a study, and she's actually looking to publish, and we were participating in that. And so would you consider that publishable? And just to follow up on that, is it a challenge for the journals to find reviewers who can properly assess that this actually is an impact? Because that's another big part too. People may not even be aware of the challenges, and someone's reviewing something that maybe they're not qualified to review.
Do you see there are many points? You raise one point. There are this session will not finish. It is just a start. Yes, all this question needs answers. Yes. Yes, okay.
Okay, well, I'll try and address this thorny question you put to me. It all comes down to quality of the research. Ultimately, for any peer-reviewed journal, we're interested in quality research. And so when I'm talking about this data that can be published, there are levels of quality in that data. Survey data is qualitative data. There are journals that publish a lot of qualitative data. There is specialist methodology for that. There are very well qualified referees out there who are very well adapted to qualitative work. So yes, there is probably a venue for a large survey who will have the specialist knowledge and expertise to look at that.
Dr. Charlotte? Yeah. And after? Yeah. Yes, please.
Yeah. Yes, I have another question. Dissemination of knowledge is not only by journals, it's also by congresses. And as we said, we have the meetings, ESMO and ASCO. We have the ASTRO and we have the ASTRO. Like we have the red and we have the green. And so we are very narrowed in those dissemination places, which are very Western dominated as well. Because of the language barrier. On the other side, when you have a meeting in Uruguay or even in Brazil and have people there to speak, I must say I cannot accept those invitations all the time. It's traveling, it's intensive. So to have a quality meeting elsewhere or in different audiences is not easy. My question is, can we be more innovative there? Can we use those meetings who are more local? So we have the aortic example, which is always in places also difficult to travel to. Could that be a forum, however, of people speaking who can be kind of a reporting journal or special edition after, which can help the spread, at least the dissemination part of that meeting, because then it can have a larger reach.
So as eCancer, we've been to, I think, the last 5 or 6 aortic meetings, and we interview all the key speakers there and make the videos available for free so that people that can't travel to all these meetings can have access to that information. You know, they're normally published within a week. So that's exactly, you know, what we're about as an organisation, because people can't travel to every meeting. You know, we're going to ASCO next week, and we'll do between 60 and 80 interviews with the key speakers there. But then, yeah, we're going to aortic in November. We run educational events in Latin America and India. So we're trying to... But also, just on the question that you said, or the point that you made previously about, we work with authors, so we're publishing a special issue from Africa at the moment. I think quite a few of the authors, or some of the authors, are definitely in this room. Peter Boyle is the key author on that, and but a lot of the papers that were submitted aren't of the standard that would normally be accepted by, you know, Western journals. So we work with the authors to bring everything up to the standard that is required to be published in a Western journal, you know. And so we, you know, as an organisation, that is what we're all about, bringing information from different parts of the world to the global oncology community with a view to improving patient care?
I will answer. No, give me one second. My answer to the meetings is that the meetings are out of the question by now. Why? If you analyze the process of the meetings, they have an education committee. I know the process of ASCO, of ESMO, and we are not looking for that niche because they are constituted by academic people divided in breast, colon, colorectal, and the topics that are usually the topics that we are discussing here are quite limited and restricted for very small audiences. So we are trying to expand exactly doing the things that the meetings are not doing. So our scope is different.
Please, yes?
Yeah, it's been very interesting as I watch things progress in the world that there is now a very advanced and very sophisticated medical marijuana community around the world. That's the reason that we see legalization constantly approached everywhere. And the reality is many of these activists are very responsible people, and they have medical records from the people that have been treated. And the reality, once again, is that the official medical community is so far out of touch with the advancements that have occurred by using this plant. And what's been really a mind blower to me is to find out that there are still doctors in the world who don't know that we have an endocannabinoid system that regulates everything in our body, meaning our immune system, digestive, cardiovascular, skin, bones, reproductive. Everything in your body is homeostatically regulated by your cannabinoids. So I would urge the various journals to at least get some methodology, some creative solution, so that the voice of the people who are far ahead of the scientific community at this point can help lead you so you can start to understand the directions you should go and the possibilities that are out there. Because we cure cancer at a much greater rate than you do, and we do it by making people healthy rather than sick.
Very important notice. I would, Twalib, yes, I was waiting. Yes, I was waiting.
First of all, it's a great pleasure to have all these editors-in-chief of these high-impact journals. The rejection rate from these high-impact journals is quite high. And sometimes I think there is a feeling that whenever there is an article or journal article from Africa, there is some bias to start with. I would like to have a situation like the E-Cancer Journal, where, because English is not our mother tongue, so there will always be a problem with language. And then you said randomized clinical trials. We may not be doing that because we don't do those. But if the editors-in-chief were going to be helpful like the E-Cancer Journal, because I was involved in this cancer control series, and then we sent, then they reviewed very positive reviews, and then we worked on that to help bring the standard of those articles to the standards of the journal. But sometimes we are in a situation where even the reviewers, when they review these journals and they come back, you look at them and you don't agree with what the reviewers wanted to do. I know the editor-in-chief doesn't have to believe or to take everything that the reviewer says. But if the editor-in-chief is not going to be helpful, then it becomes a problem. So I would like to ask editors-in-chief,
can I add to help,
so that we can bring the standard of this. if there is good data that can be reportable, so that, because some articles have been refused in this journal, you send it to another journal, same impact factor, and it's acceptable. And you ask yourself, what is the basis? If Lancet Oncology refuses that article, the Red Journal accepts it, what is the explanation?
I would like to add something before reply, that this current, or whatever you call it, the start of something, should be joined with other things. One of the things that we will speak about it today, and I spoke about it yesterday, that we should raise the levels of scientific researches in developing countries. This is not a call to accept paper which is not a way of science or a way of sense. And that is why I appreciated a lot your comments and your feedback that about writing you can edit the article before publication, and you add the second the colleague from Harvard or from Pennsylvania or from Oxford as a second author. Why not? It is win-win. But also, that is why yesterday we spoke about the global oncology university. I know that. Okay, that. One of its objectives is not just to give some lecture or online lecture. We should cooperate together, and you are all welcomed. You are all welcome to teach investigators, young investigators, to cooperate with them, to help them to publish, to not publish, to do good research, to revise their data, to revise their statistics, to edit with them, and to publish with them. And you should be also something like connection with other institutes. That is what I by the way, e-cancer, and I can send you, Charlotte, about the feedback of some concern of our article. I was speaking about the same thing, how that researcher or professor in Harvard, Pennsylvania, Oxford, whatever, get benefit of investigator or researcher or clinician or radiologist in Tanzania, in Egypt, and whatever, to be co-workers. Then all would win. He has a lot of co-workers everywhere in the world. All would gain, and no brain drain, because this man in Tanzania, in Cameroon, in West Europe or something, doing a good research and be part of international community. It is a part. This publication is just a part. But it is not call for lowering the level of publications. But the world is in need of new of publication concentrated on the aspect of increasing better value cancer treatment and increase affordability via scientific approaches. And this needs good scientific research.
Can I add something? So,
yes.
Science has a very low accept rate of about 7% of all submissions, but we travel to try and educate people about what we're looking for and how things work. And science, like Lancet Oncology, works a lot with authors to developmentally edit their work so that they communicate as clearly as they possibly can. And I'd also just like to say, to shamelessly plug my session in 5 minutes, which is all about how science works, what editors are looking for, how reviews work, the entire editorial process behind the scenes, and how to communicate your work. And it's all about exactly the problem you're talking about.
And just to take this question of the concern that was raised that there may be bias against a paper that comes from a developing country, which is a serious concern. So we've instituted, and I know another number of the other journals have instituted double-blind review. So the reviewer has no idea where the paper came from, has no idea who the authors are. And that has been, I think, very reassuring for our authors.
Professor Eric Ford?
Yeah. I also appreciate double-blind review as a reviewer, too, actually. But I wanted to make a comment, question sort of related to this, which is what I've noticed is the issue much further upstream, so in the study design and the conception of the research. So, I mean, there's been a lot of discussion around the language and presentation of a study as it's already done. I like the twinning model was interesting, but that happens really, really much later in the process. And if you don't have a good study design from the beginning, it's really hard to get it up to that level. So does anybody have any experience around this? I've been struggling with this with my collaborators and trying to, assist in any way I can. It's quite challenging. They're highly motivated.
Very good.
Yeah, thank you for that comment. It's a really important point, and actually it's one of the things we work on quite strongly in the Lancet group. We run publishing workshops and one-to-one workshops all the time. I know some of my colleagues here do these as well. And actually some of the things when I'm running those workshops, the key thing is actually protocol design, study design, analysis. And those are fundamental barriers to publication, which have been set in stone 10 years ago. So actually a lot of the work we do on those workshops is quite often around study design, endpoints, analysis. What do you aim to get from this study? So that this informs your design. But we're also part of a program coming to the point of assistance. We're part of a program called Publishers Without Borders. And in that program, we also offer assistance to local journals in countries if they need help in how they set up an ed board, how they get registered into PubMed, how do they set up peer review systems. There's a lot of cross-learning that can be helped there, and we have a program within our parent company that the Lancet participates in very frequently.
We have 2 minutes only. Okay.
So I heard earlier on that the average research subject group are male and 70 kg. So how can you be review blind if the subject population is from an underserved country? Because that will obviously be in the paper.
Well, it is blind. It's not necessarily blind to the nation, but it's blind to the authors. I mean, if it's important that it's research that was done in Kenya, then that has to be explicitly stated in the data. That information is not redacted.
Right.
So the double-blind review is really a way of reducing the bias that reviewers may or may not have against authors from what they may consider to be lesser universities. Unconscious bias.
And at the end, I'm glad that there are a need for many feedback. Please write with your title, name, and affiliation and everything, because you have to finish. Yes? Okay, please, quickly.
So a lot of my peers used to follow the Journal of negative results. They mentioned that really taught them the type of research that they should not do and not waste their resources and time on. So how important is it to publish negative results in journals?
I mean, really important. A well-done negative study is a huge contribution.
Do you accept that, because we are finishing the time, that you send even your question and we send the panelists and to reply, and you kindly reply after, because it is very big topic and very needed, and then you summarize?
Yes.
Yes?
2 minutes.
Yes.
Well, we think that the perfect is enemy of the good. So I will try to summarize, I think that in a simple way, if possible, some core concepts as take-home messages, and perhaps we can draft something for distribution later.
Yes.
Okay? So the idea is that the journals can collaborate in promoting good study design and methodology, that without a good design and methodology, really a publication is impossible. But also with proper reviewers, and at The Oncologist I wrote an editorial that is published about these objectives. reviewers, not only that they have the science knowledge, but they understand the global issues in order to be fair with the evaluations. And also, if necessary, the journals may help with the proper native English edition. But I think that the ideas expressed by the panel are basically to expand the science, knowledge, and data to more countries and populations, and to improve the quality of the publications worldwide. That is something that is, I think, very basic, but also to include a part of science research treatments to include more cancer control information. There are other priorities, but I tried to summarize in 3 or 4 points, I think, the main issues during this debate.
Thank you very much. It is not debate, we are completing each other. And at the end, please write your question, write your feedback, write your suggestion, write your input, write how you can do this. And if there is any question, the panelists accepted kindly that if you send to me or to Will, we'll forward to the panelists and you'll receive reply. It's continuous. This is just a start. This, as I said in the start, is 1 hour, but a start of movement. Maybe it is a movement, Eduardo. Okay. Thank you for all panelists, really. Thank you all. You are partners, and with you, we can do something. Thank you very much.